Brain tumors account for 1 in every 100 cancers diagnosed annually in the United States. We spoke with Dr. Javed-Siddiqi of Desert Regional Medical Center in Palm Springs to find out about the diagnosis and the effectiveness of treatments.
A brain tumor is an abnormal growth in the brain that arises out of cells that are normal in the brain. So neurons, brain cells, other cells, glial cells. When they have mutations, they can become abnormal, and then there can be excessive growth, and that can become a mass in the brain that can push on normal parts of the brain, cause seizures, cause other problems. The brain tumors can present in a myriad of symptoms, from headache. Usually those headaches tend to be focal headaches, meaning the patient can point to somewhere on their head. Occasionally there can be diffuse headaches coming from the back of the head to the front of the head. Other times they can have seizures. Of course, they can have weakness on one side of the body, the other speech problems, visual problems. So really, any or all of the above. Usually the diagnosis these days is done with initial diagnosis with a CAT scan of the brain, and then I always like to have an MRI scan of the brain to get images in all different planes. The most common brain tumor in an adult is a metastatic tumor, meaning it has come from somewhere else. Lung cancer in smokers, for example. In younger age groups, what is referred to as benign or lesser aggressive tumors are more common. The treatments are different, of course. The more malignant end of the spectrum tumors may need surgery, radiation, and chemotherapy, whereas the more benign tumors, they may simply need a biopsy to make the diagnosis, and then they could be observed occasionally for progression or growth, and they may grow very slowly over years. And then if they do become critical, where they're pushing on important structures, then can be resected, or other modes of therapy can be used. There's radiosurgery, which is a stereotactically driven focused radiation of the tumor. That's usually used for more aggressive types of tumors, but some less aggressive tumors are also benefiting from that. That's a very focused form of radiation, and whole brain radiation is also used in some patients who have multiple metastases all over the brain, for example, and then they would get the whole brain radiation. The other mainstay of treatment is chemotherapy, where patients get IV chemotherapy agents for fighting certain specific kinds of tumors. What's on the horizon are treatments, new kinds of treatments for brain tumors, such as gene therapy, which are still at this very experimental stage at this time. So we would then be able to inject kind of an anti-tumor gene that goes and attacks the tumor, or perhaps that tumor gene can outline the tumor for us. So if it's infiltrating the brain, then we can see the margins clearly. Because one of the problems for the surgeon is that we cannot tell where the edge of the tumor is intraoperatively at times. And any way of marking the edge with either a radioactively isotope marked gene, which then goes and attaches itself to the edge of the tumor and then makes itself visible to the surgeon, probably these kind of things have improved in the future.